Tonight, a family friend has identified the nurse infected with Ebola in Dallas. 26-year-old Nina Pham works at Texas Presbyterian Hospital, and she helped treat Thomas Eric Duncan before he died. On Sunday, the director of the Centers for Disease Control said some breach in protocol caused her to contract the virus. However, he says it may not be her fault or the hospital's, and says it will be rethinking protocols used to protect healthcare workers.
We have to rethink the way we address Ebola infection control, because even a single infection is unacceptable.
Pham is the first person ever to contract Ebola in the United States. At a news conference today, the Texas Health Commissioner said his top priority is tracing all of Duncan and Pham's contacts. They are expanding their efforts to help keep the CDC keep track of everyone who may have come in contact with the virus. Right now, the CDC says it is monitoring 49 contacts, 11 who had exposure to the virus and 38 who were possibly exposed. The CDC uses contact tracing to keep track. The first step is to isolate and provide care for the Ebola patient. Then they ask about the patient's contacts and watch for symptoms of the sickness for about 21 days. The CDC has to repeat that cycle until there are no new patients. The biggest cause for concern is if officials miss a contact, because that person could spread Ebola to new people. A scare in Boston this afternoon as teams in hazmat suits have taken 5 people off of a plane there, saying they showed flu-like symptoms. Family members say the sick people were returning from a religious trip to Saudi Arabia. In Louisiana, a waste disposal facility says they will not accept the ashes of Thomas Eric Duncan's belongings. Those include things like linen, bedding, and carpet from the Dallas apartment where Duncan was staying. Late last week, they were destroyed in an incinerator in southeast Texas. Doctors say that is one of the few ways to kill the virus. Louisiana's Attorney General today even threatened to go to court to keep those ashes out of the landfill.